I'm going to perform hand hygiene. I'm going to provide privacy for my patient. I am going to introduce myself. Hi, how are you? My name is Lindsay. I'll be your nurse today, okay? I'll be in here for about maybe 20 to 30 minutes. I'm going to be doing a head-to-toe assessment on you, okay? Get a better idea of what's going on today, all right? Is that all right? Good. All right. Can you go ahead and state your name and date of birth for me? All right, good. All right. Do you have any allergies? No? Good. Are you in any pain at all right now? No? Okay, good. I can see that my patient has no signs of acute distress. So I have a couple other silly questions to ask you, okay? Do you know where you are today? Good. Can you tell me what year it is? Good. And can you tell me why you're here today? Good. So my patient is alert and oriented ×4. Based on his overall appearance, I can tell that his facial expression and mood are appropriate to the situation. I can also tell that he has clear speech. Okay, so I'm going to go ahead and do a skin assessment on you, okay? Can see based on just looking at you that your skin is even toned throughout and appropriate to race. I don't see any signs of any lesions, any wounds, or incisions at all. Palpating your skin, it is nice, dry, and warm. Okay. I'm going to go ahead and look at your nails here, okay? Nail beds are nice and pink. Cap refills less than 2 seconds, good, and no signs of clubbing at all right? Now I'm going to go ahead and look at your head. I don't see any lesions or infestations of any kind. All right, good. I'm going to go ahead and do cranial nerve 5 now, which is trigeminal. So just go ahead and tell me when you feel this on your forehead. Okay, go ahead and close your eyes for me, okay? Good. 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 All right. Can you go ahead and clench your teeth for me as well? Good. All right. So cranial nerve 5, motor and sensory are intact. So I'm gonna go ahead and move on to your facial nerve, okay, which is cranial nerve number 7. Sorry. Can you go ahead and smile for me? Frown. Good. Can you go ahead and raise your eyebrows for me as well? Good. All right, so now I'm going to go ahead and check cranial nerve 11, which is your spinal accessory. Okay, so I'm going to go ahead and, can you push up against the resistance on my hands? Good. How about the pushing your head this way towards my hand and the other way? Good. All right, so now I'm going to go ahead and look in your eyes, okay? But just looking at the external eye without shining any light, I don't see any redness or any discharge. I'm going to put this back, okay? I'm going to go ahead and, okay. Your conjunctiva is pink and moist and your sclera is white. Okay, so now I'm going to go ahead and I'm going to shine this pen light in your eye, okay? Just look straight at me, all right? Good. Do the other eye too. Good. Okay, so I can see that your pupils are equal, round, reactive to light with accommodation at 3 to 5 millimeters. So I'm going to go ahead now and I'm going to assess cranial nerves 3, 4, and 6, which are ocular motor, trochlear, I'm sure I'm butchering these, sorry, and abduns. So I'm going to go ahead and check the 6 cardinal fields of gaze. So go ahead and just follow my pen light with your eyes, okay? Don't move your head, okay? Good. All right. So now I'm going to go ahead and move on to your ears here, okay? Looking at your external ear, I don't see any redness or discharge or anything like that. Good. So now I'm going to go ahead and I'm going to test for cranial nerve 8, which is vestibular cochlear. Sorry, I'm probably pronouncing these incorrectly. So it's a whispered voice test. Pretty much I'm going to stand behind you on each side, okay? And I'm going to tell you a word, and if you can repeat it back to me, you pass, okay? Yellow. Good. Okay, so now I'm going to go ahead and look at your nose, okay? shining at my light and seeing I don't see any deformity. It's symmetrical with your facial features. No inflammation, no drainage, no septal deformity as well. Can you go ahead and cover one nostril and breathe in? Good, and do the other one? Good, so both nares are patent bilaterally. So now I'm going to go ahead and I'm going to look at your mouth here, okay? I'm going to look at your lips, your tongues, and your gums, okay? You can go ahead and open your mouth for me. Good, good. So your gums, your lips, and your tongue are all pink and moist. Good job. So now I'm going to go ahead and I'm going to assess cranial nerves 9 and 10, which are glossopharyngeal and the vagus. So I'm going to look in your mouth one more time. Okay, you can go ahead and say ah for me. Good, so that uvula went up and it's midline. Okay, I'm also gonna check your gag reflex here real quick, okay? Sorry, it might hurt just a little bit. All right, good job. Okay, so now I'm gonna do cranial nerve 12, which is your hypoglossal nerve, and I'm gonna go ahead and have you stick out your tongue one more time, okay? Good, so your tongue is symmetrical, it's not, no deformities, no lesions of any kind, and it's symmetrical. Okay. So now I'm going to go ahead and move on to respiratory, okay? So as of I can see right now, you're not using any accessory muscles at this time. So I'm going to go ahead now and I'm going to auscultate lung fields. I'm going to do it in a side-to-side pattern over bare skin, okay? Whenever I move my stethoscope, just take a deep breath in for me, okay? Okay. Right upper lobe. Left upper lobe. Right middle lobe. Left lower lobe. Right lower lobe. And left lower lobe. All right, good. So now I'm going to go ahead and I'm going to do it posteriorly on your back here, okay? And just the same thing, I would do it in a side-to-side. I'm going to do it in a side-to-side pattern over bare skin. Just take a deep breath in for me, okay? All right. Okay. All right. Right upper lobe. Left upper lobe. Right lower lobe. Left lower lobe. Right lower lobe. Left lower lobe. Okay, good. Set you back there, sorry. Okay, so lung fields are clear on auscultation. So now I'm going to go ahead and I'm going to move on to your cardiovascular system, okay? So I'm going to go ahead and I'm going to palpate your carotid pulses one at a time, okay? Good. So your carotid pulses have a regular rate and rhythm 2+ bilaterally. Now I'm going to go ahead and I'm going to check for JVD, okay? Go ahead and turn your head there for me. All right, good. No JVD noted on that one. Okay. So and I'll check for edema, so I would like kind of touch the skin a little bit, see if it was pitting at all, but I don't really see any edema at all. You would probably be able to see it more than you would feel it at first. But to be sure, you would want to make sure you feel it. So now I'm going to go ahead and I'm going to auscultate your cardiac areas, okay? And I would do it over bare skin, and I'm going to use my diaphragm first, okay? All right. Second intercostal space, right sternal border, aortic. Second intercostal space, left sternal border, pulmonic. Third intercostal space, left sternal border, Erb's point. And then fifth intercostal space, left sternal border, tricuspid. And then fifth intercostal space, mid-clavicular line, and that will be mitral. All right, good. So now I'm going to go ahead and do the same thing over bare skin with my bell. Okay. pulmonic, Erb's point, tricuspid, and mitral. All right, good. S1 and S2 are heard throughout. No murmurs noted. Okay, so now I'm going to go ahead and I'm going to check your radial pulses, okay? I'm going to do those at the same time here. Okay. Good. All right. Radial pulses, I have a regular rate and rhythm, 2+ bilaterally. Okay, so now I'm going to go ahead and move down to your pedal pulses, okay? So I'm going to go ahead and do your posterior tibialis first, okay? I can go ahead and palpate these at the same time here. Here's the left one and here's the right one. All right. Good, I can feel those pretty good. Now I'm going to go ahead and move them to your doralis pedis. All right, good, good. So sometimes these are not palpable, so you'd have to get a Doppler to make sure you can feel those before you tell anybody that they have no pulse at all. Okie dokie, so now I'm going to go ahead and I'm going to move to abdomen, okay, and check out your contour and your symmetry of your abdomen. You have a nice flat contour. Your umbilicus is midline, no masses or anything, so your abdomen is nice and symmetrical there. So now I'm going to go ahead and listen to your bowel sounds, okay? Okay. Starting in the right lower quadrant, and move to the right upper quadrant, moving over to your left upper quadrant, and down to your left lower quadrant. All right, good. So for an actual examination, I would make sure I listen for a full minute in each quadrant, and if something sounded abnormal or the bowel sound was absent, I would listen for an additional 4 minutes for a total of 5 in that quadrant. Okay, good. All right, so now I'm going to go ahead and do a light palpation of your abdomen, okay? So let me know if you feel any pain, okay? So I'll go ahead and start in the right lower quadrant and move to the right upper quadrant, and then move over to the left upper quadrant and move down to the left lower quadrant. Was any pain at all? All right, good. So there was no tenderness on palpation, and there was also no distension noted as well. So now I'm going to go ahead and I'm going to do your musculoskeletal system, okay? So I'm going to check out your joints. We're going to inspect, palpate, range of motion, and muscle strength, okay? All right. So I'm going to go ahead and start with your temporomandibular joint, which is your jaw here, okay? And looking at it, it's symmetrical and the contour is bilateral. So I'm going to go ahead and feel now, okay? And they feel, yeah, it feels good. No pain at all. All right, good. Can you go ahead and open your jaw for me? All right, good. No crepitus, no felt or heard. Okay, so now I'm going to go ahead and I'm going to do range of motion with you, okay? Go ahead and open your mouth again. Good. Can you do side to side? Good. Okay, so now I'm going to go ahead and test the muscle strength, okay? So I'm going to go ahead and have you open your mouth against my resistance. Good job. Okay, so now I'm going to move down into your elbows, okay? Doing pretty much the same thing. So your elbows are symmetrical and the contour is bilateral. Okay, so now I'm going to go ahead and I'm going to feel no pain. Okay, good. All right, so now we're going to go ahead and do range of motion, okay? So can you go ahead and put your arms out like this and then flip them over and then do it again? Good. Then go ahead and I'm going to have you raise one and then put it back down. Good. Do the other one. Good. Okay, so now we're going to do muscle strength, okay? So pretty much against my resistance like we did last time. So go ahead and pull your arm in and push your arm. Good. I'll do this one. Go ahead and pull and push. Good. Okay, so now we're going to move down to your knees, okay? Looking at your knees, I can tell that they're symmetrical and the contour bilaterally. Okay, so I'm going to go ahead and feel on your knees. Any pain? Okay, good. No crepitus felt here either. Okay, so I'm going to go ahead and do range of motion now, all right? So can you go ahead and lift your knee back and then pull it forward. Do the same with the other one. Good, good. No crepitus hurt on that either. So I'm going to go ahead and test your muscle strength, okay? So go ahead and pull your leg in. Good, and push your leg out. Good. And we'll do this one. Push out and pull in. Good. Okay, so now we're going to do feet, okay? So looking at his feet, I can tell they are symmetrical and the contour is good bilaterally. Okay, so now I'm going to go ahead and I'm going to feel, okay? Any pain? Okay, good. Make sure you get down in here with all the bones in your feet. So I'm going to feel all of that down there. And I don't feel any abnormalities or anything like that, which is good. Okay, so now we're going to do range of motion, okay? So I'm going to need you to put your feet out. Good. Can you bring it back in for me? Good. All right, can you go ahead and put your heels together and to your toes? Good. Okay, so now we're going to do muscle strength, okay? So can you go ahead and pull your foot up? And then can you push your foot? Good. Then we'll do this one. And pull up and push. Awesome. Thank you so much for that. It was great. So then now I would test the sensory, but I don't have a tuning fork, so pretty much I'll just use this and show you guys what I would do. So you'd strike the tuning fork and you'd put it on his big toe and make sure that he can feel it running up through his leg and his toes on both sides. So just tap it there. All right, good. Okay, so now I'm going to test for gait, but as for Tigger, he can't really stand up straight, so I would make him walk around the room. I'd probably do heel to toe, and then another one would be like walking on your heels, trying to maintain a straight line. Another one would be a Romberg's test to make sure that their balance is in place. So you'd have your patient stand straight up, feet together, arms at their side, and close their eyes. And then I would hold, I would keep my hands out a little farther to make sure that they don't fall. And I would count for 20 seconds. And if they end up losing balance or falling or kind of swaying over, I would make sure that I stop counting and I would make sure I note that. Okie dokie. So I think actually we are all done here. Can I get a pain level on you? You have any pain at all after doing all of that? No? Good. Okay, so make sure that his bed is in the lowest position. It's locked. The side rails are up. His call light's within reach. Thank you so much for making this pretty easy on me. I appreciate it. If there's anything else you need, make sure you have your collar right there. Just let me know, okay? And then I would perform hand hygiene on my way out. All right.